give an update on cases, then I'll inform you of two important changes, one on the booster jab and one on exposure site notifications. There are currently 105 people with COVID receiving care in Territory hospitals. This represents about 2.5% of our active cases. There are 14 patients currently receiving requiring oxygen in our hospitals, one less than yesterday. We have 3 patients receiving care in ICU, 2 in Darwin and 1 in Alice Springs, and that's 1 less than yesterday too. So pretty similar numbers to yesterday. To new cases, there were 940 new cases of COVID-19 in the Northern Territory in 24 hours to 8 p.m. last night. Yesterday's case numbers have also been revised up from 626 to 747. There is an additional community in Central Australia that we are concerned about, and Blood Watch. We are still getting detail on new cases there, but we understand there are several, and there's a community with a very low vaccination rate. From 2 p.m. today, and Blood Watch will enter a 48-hour lockdown to allow us to test the community and try to contain it as much as possible. Active cases in the Northern Territory now stand at 4,200. Around 2/3 of our cases are occurring in the top end, well over half are in Darwin and Palmerston. We have seen a sharp spike in cases over the last few days, mainly in Darwin, as more and more families return home from interstate holiday. So it's not surprising, and we can expect that to continue for a few days to a week. This doesn't change our overall settings for the Territory. It just means it's more important than ever that we stick to the measures that are in place to keep us safe. People who are required to take a test, like recent arrivals, need to register their result with us as soon as possible. Please make sure you're wearing your mask and practicing social distancing where required. And if you have any symptoms, get tested. Now to the booster jab. The Territory's mandatory vaccination policy worked. More than 95% of Territorians aged 16 and over have received 2 jabs, and we are now getting close to 90% for 5 and over. That's a terrific level of protection and has saved lives. I'm absolutely sure of that. We knew the Omicron wave would spread quickly and aggressively, and it has. We also knew that fully vaccinated Territorians would be better protected, and they are. Today, there are more than 4,000 active cases of coronavirus in the Northern Territory. Just 3 people are receiving care in our intensive care units. Just 0.07% of our cases, less than 1 in every 1,000 cases, is in the ICU. Overwhelmingly, the vaccines have kept Territorians out of hospital. They have kept Territorians out of the ICU and off ventilators, and they have kept Territorians alive. Vaccination has worked, and now we need to keep it working. As we flagged last year, the booster shot will become part of the Territory's mandatory vaccination policy for many workers. We haven't gone through all of this sacrifice in the past 2 years just to drop the ball now. The Deputy Chief Health Officer can talk more about why the booster shot is important in a moment. 2 doses of the vaccine has given tens of thousands of Territorians excellent protection against a severe illness. The booster shot makes sure the protection is stronger and lasts longer. Everyone over 18 is eligible to receive their booster. And soon as ATAGI gives the final approval, 16 and 17-year-olds will be eligible for a Pfizer booster. From Monday, the interval between getting your second jab and getting your booster will be reduced to 3 months. The immunity that 2 doses of the vaccine provides does not last forever. If you got your second shot 4, 5, 6 months ago, your level of protection has gone down, which means your vulnerability has gone up, especially now that we have widespread COVID in the Territory. Right now, only 1/3 of adult Territorians have received their booster jab. That leaves a lot of Territorians more vulnerable to COVID than they have to be. The mandate worked, the booster is important, and now it is part of the mandate. There will be 2 deadlines for the booster jab. The first for workers in designated high-risk workplaces, and the second for the remainder of workers in public-facing roles who are required to be fully vaccinated. The designated high-risk workplaces are hospitals and healthcare facilities, residential aged care facilities, disability residential facilities, correctional and detention facilities, and finally renal, hostels, family violence shelters, homeless shelters and sobering up shelters. Workers in these settings are required to get their booster shot by Friday the 11th of March or within 4 weeks of becoming eligible for the booster. The 11th of March is 6 weeks from today, and most people in these high-risk workplaces were required to be vaccinated back in September, so most are well and truly eligible for the boost right now, and there is 6 weeks to get it. These workers are among the first in the Territory to be vaccinated, which means those who have not received their booster would have seen their immunity to the virus substantially diminish over the past few months. For everyone else, the mandate applies to the same people it applied to last time. As a reminder, you are required to be fully vaccinated if in the course of your work you come into contact with vulnerable people, your workplace poses a high risk of infection, or you perform work that is necessary for the operation or maintenance of essential infrastructure or logistics in the Territory. For these Territorians, the deadline for getting the booster shot is Friday the 22nd of April. That is 3 months after the Christmas Eve deadline for the second jab, plus an extra 4 weeks grace period. That means everyone has heaps of time to get boosted and stay protected. But if you are eligible now, don't wait till April, book in your jab today. Finally, we've also made a change to how Territorians are notified when they've been to an exposure site. Currently, people get a text message to tell them they've been in a location during the same time period as a COVID positive person, a half-hour window. We know Territorians wanted more information than that. Our teams have been working hard on a solution and now it is ready. From later today, the Territory check-in app will now include information on any exposure sites you have been to. So instead of receiving a general text message, you can just go into the app on your phone and check whether or not you've been to an exposure site. It will list the location and the time period. If you have notifications enabled on your phone, you will also get an alert through the app, I believe, and I'll double check that. There may be some teething issues. There always seems to be when we are dealing with technology. It should be up and running later today. As I've said before, and I really want to stress this point, getting an alert that you've been to an exposure site is not a cause for you to panic. It's not a direction to isolate. It's just information for you so that you can make an informed judgment. If you get an alert from the check-in app and you're feeling a bit unwell, that's a very, very good sign to take a test. Thank you very much.
Thank you, Chief Minister. Good morning. I'd like to provide an update on an extension on some of the numbers today. So as the Chief Minister mentioned, we have 940 cases reported in the last 24 hours. That is an increase from yesterday and an increase from the average that we were handling early in the week and last week. We are watching this closely. We are aiming to get a better understanding of this new second wave that is coming on this time to be able to flatten that curve and keep our health services operational and able to care for Territorians in these times. The total number of active cases is 4,200. In hospital, we got 105 Territorians, of which 14 are on oxygen and 3 are in intensive care. I'd like to acknowledge the hard work that our clinicians in hospitals and all our health care providers are doing to care for those Territorians in need at this time. I'd like to acknowledge the opening of extra COVID wards in rolled out in hospital and the ability to tailor our hospitals to manage more and more COVID positive patients. I'd also like to acknowledge the hard work that we are doing and some of our healthcare providers are doing to manage more and more COVID cases outside of hospital. We got a number of cases that are managed in what we call hospital in the home, managed by our IFD physicians, also a number of patients that are managed by general practitioners, rural medical practitioners, and primary healthcare providers, not only here in Darwin and Alice Springs, but also across all over the Territory. I'd like to say that the hospitalization rate remains stable at 2.5%. However, this number increases as the number of cases increases, and we need to be mindful of that. ICU utilization remains low at 0.07% and within our capacity to manage. I'd like to now talk about the outbreaks in remote communities. We have a number of communities that are affected with significant outbreaks, many of them with lockdowns. We have more and more cases in more and more remote communities. We are watching this closely and we're working in partnership with Aboriginal health organizations, with other community organizations and community members to find the best way to manage those outbreaks in community. And the range goes from identifying those cases, emphasizing in contact tracing and isolation and quarantine, removing some of the complex cases and trying to get control of these outbreaks. In other instances, it goes around identifying high-risk COVID positive patients that will benefit from treatment and should be better cared for closer to larger centers while we treat the less complex cases closer to home in a patient-centered way. I'd like to talk about vaccinations now. We know that vaccination is our best tool to fight this pandemic. It's something that we didn't have initially. We managed to keep COVID away from the Territory for almost 2 years until we had a vaccine available and a significant proportion of our population fully vaccinated. That's what kept this outbreak under control, and we are not seeing more Territorians being very ill with COVID. However, as the Chief Minister announced, some of the immunity that you gain through vaccines wean off as time passes by. Omicron is a new strain of this virus that has mutated enough for your immune system to require a bit of a booster to be better placed to respond to this infection. And we are really encouraging Territorians to complete that vaccination with the booster if you are eligible now. That eligibility has changed now to 3 months after your second dose, and we are seeing a very slow increase in uptake of boosters in recent weeks of about 3% per week, sitting at the moment at 33% of Territorians that are eligible for booster having received one. So we like to see more Territorians coming forward. We know that boosters work. That's what the evidence tells us from international data. That's what the HSPPC analysis of booster vaccinations and its advantages, and we know that it significantly reduces not only your chance of getting COVID, but more importantly, your chances of passing COVID to others and getting very sick with COVID requiring hospitalization. We also like to talk about vaccinations of 5 to 11-year-olds, something that we're seeing a good effort from Territorians coming forward and bringing your kids for vaccination. That number is sitting now at 35% of eligible children. We would like to see more and more kids coming forward to receive those vaccinations before school start and then receive their boosters or the reinforcement of second doses to follow. Thank you.
Good afternoon, everybody. Obviously, with school returning in the very near future, we anticipate there's a lot more arrivals, and we're certainly seeing that through airport arrivals and also across our road border checkpoints. It is the case that more of our population is returning as the critical school term starts, and what we urge people to be critically aware of is your own practices are the greatest mitigation to the spread of COVID in the Northern Territory. As has been spoken about, physical distancing, wearing the mask, observing appropriate hygiene practices, all of these can be controlled by you as the individual. Similarly, as it relates to if you become COVID positive, take the appropriate steps to ensure that you remain out of circulation with your loved ones and with your family and friends. And that applies as equally to an Aboriginal town camp as it does to a remote community, as it does to staying in a hotel, as it does to any workplace that anyone may be exposed to. It's a simple methodology. If you're aware that you're COVID positive, take the appropriate steps, communicate with people who are likely to come in contact with you, and mitigate it. It's pretty straightforward. That will certainly help us with the continuing activity that's going on. We anticipate, and it's been spoken about before, that there would be an increase, particularly given the return of people from interstate, and we'll manage that effectively. We've still got our controls in place as it relates to border arrivals, the provision of RAT tests, the compliance with that. What we're not seeing across the board in the Northern Territory is the mask mandate compliance to the levels that it should be. And that particularly saddens me to say that in our remote communities. We really do need you to put the mask on when you're out and about in those public places and minimise the likelihood of you being able to be exposed to somebody. It's a community effort that we're asking for, and we need that to take place. The weather events obviously in South Australia have impacted our critical goods supply. We've been working with the Commonwealth Government and other agencies. We've also had the supermarkets at a meeting yesterday with senior NT government people and the Commonwealth officials to determine current supply chains. It is the case that the road and rail is going to be impacted for the foreseeable future. We're waiting on more fulsome detail as to what those timeframes will be as appropriate survey and analysis of the damage is undertaken by the South Australian authorities. The truck routes have already been identified now to come through country New South Wales, country Queensland and then into the Northern Territory. We anticipate that some supply should be re-established early next week and supermarket shelves should start to be replenished early next week. There is ample supply for most critical goods is the current advice we've got. If that starts to be diminished from what the supermarkets are advising us, we will take additional steps and we continue to work with the Commonwealth agencies involved in that. So again, from a level of practical approach here, use common sense, only take what you need at the moment to ensure that you're there. We're working to make sure that the supply chains are there. Our remote communities are well resourced for the period of the coming seasons. The advice from most of them they are adequately supplied. And again, in the event that any have a surge that diminishes their current stock, then we will happily work with them to be able to resolve that situation. We'll give further updates as they become present. We are beholden to what the advice is as it relates to certainly the rail, but my understanding is it's unlikely that's going to be resolved in the next week or so on current evaluation, and the road still has significant mud across it that is impacting on the engineers being able to make that appropriate survey. So we'll keep you in the loop in respects of that. But alternate arrangements have been explored. The roads are moving as it relates to that alternate route, and if we need to take any further action, be assured that we will. Again, there's plenty going on at the moment. We need assistance in what you're doing. We also need you to assist us in not taking away our finite resources for unnecessary things. We have had some weather events, particularly through the Barkly in Utopia region, where weather has impacted the roads. Unfortunately, people are choosing to take on those roads and are driving into flooded areas and becoming stuck, requiring our assistance, and we've got to roll out to provide a rescue service to them. Again, in the current climate, with that weather event that's going on, don't travel unless you absolutely need to. It is risky out on those roads at the moment, so continue to help us, please, to help you by doing the right thing and applying a level of common sense. Thank you.
Chief Minister, nearly 1,000 cases today. It doesn't seem like you've flattened the curve very successfully.
We were anticipating that this week we would see an increase in cases with in-state arrivals coming in. So obviously had a very flat curve. In fact, a declining signal and wastewater strength in Darwin and Alice Springs end of last week, start of this week. As anticipated, those extra cases have come in, with everyone coming back from down south in time for the school holiday to start. So this was an anticipated spike off the back of those interstate arrivals.
Did the modelling say that there would be close to 1,000 cases though? You were saying on ABC Radio last week you were expecting roughly a daily average of 450.
Yeah, that's what we've been experiencing. We knew that there would be an increase in cases with interstate arrivals. This is not anyone's expectations for now. The hope will be that it moderates back down to 450 because everyone's now come back. There will be some additional community transmission off the back of that, so it won't be a binary 900, 450, but we would like to see it moderate back towards 450 across the first week, second week of school.
Do you have the numbers for communities like Ellenwood and Millicarbity where we did have the...
We can go through, if you've got any specific questions, we can go through those details. We've got those numbers here.
Because they accounted for more than 100 cases, I think, yesterday, which wouldn't have all been returning people. There is still widespread transmission. Is that continuing?
Sometimes we're more concerned about, as you've seen today, one case in the Bloodwitch concerns us more sometimes than a greater number of cases in another remote community. It could depend on the vax rate and local services where that occurs. So we've done that 48-hour lockdown in a Bloodwitch off the back of a couple of cases because I think their vax rate is 40% first dose, 20% second. So we're concerned about in Bloodwitch. But I can have Dr. Marco, we've got the list of all those individual remotes if you want to go through them.
Yeah, I would be interested to hear that.
So in Galiwinku, we had 30 new cases in the last 24-hour period, and the total number of cases there is over 220, of which 190 remain active cases, and 104 of those cases have been cared for in community, and many other cases have been brought over to Darwin, to the Centre of National Resilience, to assist with their care. In Millicarbity, we had 7 reported in the 24-hour period for a total of 90 on that cluster.
Chief Minister, just confirming there are no plans to heed the calls from the Central Australian health groups for a Central Australia-wide lockdown or the provision of more isolation facilities?
I can go through that in considerable detail if you like, because there's a lot of thinking that goes into what we're doing and why we're doing it. If you think back to, roughly this time 2 years ago, so more March, April, we obviously had the biosecurity zones in place and interdiction points all through the Northern Territory. At that point in time, we had no COVID in the Northern Territory. We were in a different place. At the moment, we obviously have COVID in the Northern Territory. We've got targeted responses going on in a significant number of remote communities that use our resources, specifically police. Police are probably the most important resource to discuss here if you're talking about Central Australia-wide lockdown. We also learnt lessons out of that approach to biosecurity zones last time. So significant police resourcing effort to man those staff those interdiction points. Local residents quickly learned out how to drive around them, and they proved to essentially not be effective for controlling movement. The most important thing you're going to do if you're going to do a Central Australia-wide lockdown is control movement. So essentially local residents are the ones we're most concerned about. Local residents are the ones that are transmitting the virus. They are moving and they're carrying the virus with them. So I understand the why of Congress and others asking for it, but let's get into what can you actually implement and enforce, and is it workable? We know from experience, biosecurity zones won't get the result that they're looking for. We need to concentrate our resources into those communities that have actual COVID and need actual care, and make sure those people are getting the care that they need. That's where our resources are, and our lockdowns are on specific communities for that purpose. So I get why they're asking for it, but it's important we don't put resources into things that won't get an outcome, and put resources into things that we know will get an outcome. So minimising movement within a community that we're concerned about. So in this instance, say in Bladowich, and past the Yuendamu, or you're still Yuendamu, controlling movement in those communities, minimising movement, I should say, in those communities. Compliance hasn't always been perfect, and making sure we're getting the effect that we're after. So a lot of thought has gone into what our current measures are and why those are the measures. I respect AMSANT and Congress and others, and I get why they're asking for these things, but it's important we put in place those things that we know that will work and that we can actually do.
They're arguing that it's not working and that the response has been a failure and that their requests have been ignored. Given 90% of hospitalisations are Indigenous Territorians, do you think you're doing a good enough job for the Central Australian Indigenous Territorians?
We take it extremely seriously, and we're making sure everyone who needs care is getting care. The most important challenge for us is the movement of people to those places where care is able to be provided for them. So a CNR in Darwin, a top facility in Alice Springs Hospital, Royal Darwin Hospital. The biggest challenge for us, and this is not a new challenge, this is a common territory thing. We're a small population spread across a wide area. We've always got to make sure we get people into those areas where they can be looked after. This is the challenge in Central Australia. It's also the challenge in the top end, and we're doing that. I think if you look at the territory response, for 2 years we've been the best. Right now, if you look at our caseload, the prevalence of COVID, how we're managing it, we've got 3 people in our ICU. If you look at other jurisdictions and how they're handling it and compare them to the territory and take into account all our vulnerabilities, the territory response remains the best in the world. Now, we cannot take it for granted. We can't stop working. There are lots of people out there doing considerable hours, and I thank them for that right across the Northern Territory. We cannot take our foot off the pedal, but Territorians have been excellent, and Territorians continue to be excellent.
Yesterday, the Deputy Cho said, yesterday that he wouldn't want to see hospitalisations going much farther than what we're seeing at the moment. We've just seen nearly 1,000 cases today. Is there any sort of scenario you can see where you'd have to start implementing stricter measures to try and bring down the number of infections?
Yeah, I personally would like to see no one in the ICU, if that makes sense. I understand what the Deputy Cho is saying. We don't want to see additional people in the hospital or in the ICU.
To be fair, sorry, that's not what he said yesterday. He said the modelling expected this peak of 95 and he wouldn't want to go much further than that. He wasn't saying he'd like to see no one. He was saying we can't go much further than this based on the modelling that we have.
I think if you play my answer back, I said I'd like to see no one in the ICU.
Yeah, and then you said you understand what he's saying about not wanting to see anyone in the ICU, which is not what he was saying. Anyway, sorry.
I think if you play back my comments, you'll see that they were accurate to context and description. So obviously, I don't want to see anyone in the ICU. I think the fair say that Deputy Cho wants to see anyone in the ICU. I also understand the point you're making, the point he's making about whether you go further or not. I get all that. Now, we've got more ICU beds available than we are currently using.
How many do you have?
And we have the ability to surge as well.
Can you interject, guys, or just want to answer questions, please?
Yeah. So none of this is a new topic. We've covered this before, and we've given these numbers publicly before as well. So we've got the capacity to use more ICU beds than we're currently using, and we've got the capacity to surge as well as we need to. We also have not made decisions that other jurisdictions have made yet as well around, say, things like elective surgery. So we've got absolutely other things that we can do if we need to do them about how we manage our patient load. So, for example, if we needed to use additional ICU beds, the cardiac facility at RDH is available and can provide that level of care. Those are things that we've considered in the past and not had to use that yet. So we've not had to go into any of our surge capacity or additional planning that is required if you need to use additional ICU beds. But that all sits there. If you want, the Deputy Cho can go into further details around the ICUs and management. Now, the recent elevated number of cases that we've seen over a couple of days, if that was to continue and that was the new level of our curve, then that would translate eventually into more hospitalisations, and we might have to make some of those decisions about elective surgery or other things. At this stage, it appears to be correlated with the increased return of people to the NT. It matches all our data around increase in arrivals. It matches all our data around the testing regimes. If for some reason those additional people coming in, that incursion coming in, leads to additional community transmission, that leads to a higher level of curve than what we currently have, then we may have to consider other measures. We want to make sure we keep our caseload within the capacity of our current hospital system to deal with, and we've always made all our planning decisions around the ability to deal with it within and not necessarily having a surge. While we have got the ability to surge, and we may need to surge, our preference is not to have to surge. So we will consider things, and we've been open about that. I think you've seen over 2 years we'll always do whatever it takes, and if that takes a big decision, we'll make a big decision to manage our caseload. So that's all on the table. I'll never rule that out. I think it's important to people out there, we won't rule those things out, but we'll keep doing what we can to make sure we give you the care that you need. Right now, of our current cases and how they're presenting and where they're presenting, we're able to give the people the care that they need.
In terms of the booster mandate, where will the line be drawn? Can Territorians expect that there's going to be a mandate put in place now every time they are required to get a booster?
And I would say the safest thing to assume, until we know any different, is that there will be boosters and we will mandate them. Until such point in time, we don't need to do that. So this is not, we're not in flu shot areas. We're not. I'd like to be able to say we're in flu shot areas. We're not there. COVID is endemic around the world. We have it in the Northern Territory. We know the third booster is required to maintain people's levels of protection where they need to be. And there's every chance, I haven't got any advice that says a fourth booster is required. I just think, same as everyone else, you look at what's happening here, there's every chance a fourth booster is going to be required at some stage, and I'll be standing here and saying the fourth booster is mandatory. Like, that is a very realistic, reasonable proposition for us to face. Right now, I'm mandating the third shot, the booster shot. I'm dealing with the facts as they are, but it'd be absolutely fair for you to assume that there may be a fourth booster down the track, and we'll mandate that as well.
Just in terms of the supply issues from the supermarkets, I know there have been calls to activate like the Defence Force and stuff like that if that's necessary. Is that something that's on the table?
At the moment, I'll pass to the Territory Controller who's done a lot of work in this space. At the moment, the option around the Barclay is viable, and that's going to get food into the Northern Territory. If the Barclay was to get cut off, we start moving to exceptional circumstances, and then a whole range of things might need to be considered. At the moment, though, supply should be good and sufficient through the Barclay, but I'll have the Territory Controller add to that.
Yeah, thank you. Unfortunately, we've seen, again, people surge on the facilities once there was awareness of that road being cut off, and probably take above what they really need, planning arguably for a doomsday scenario. That's not what is really present to us at the moment. Our supply chain that we rely on coming from South Australia has been impacted. There's no denying that. But many of our stores up here, and our supermarkets in particular, have significant holdings, particularly around non-perishables. The short-term impact is the fact that people have surged and taken beyond what they genuinely require. We're working with those supermarkets to make sure that the perishables can be supplied as quickly and as reasonably as possible. As I say, the latest resolution anticipates that by early next week, many of those stocks should come. But I also suggest there's plenty of small businesses, butchers, other places, little grocers, that have all got supply there for the time being, as does many of the fast food chains. Now, we know that some of the fast food chains have already advertised the fact that they've been impacted by supply, but they've made arrangements within the Territory to be able to move adequate supply through for them. So we'll continue to provide that assistance, but the critical thing for us to understand at this point in time is what is that length of time going to be where that transport route we rely on from South Australia is going to be detrimentally impacted, and then what can we put in as a sustainable supply chain, working in partnership with those commercial entities for that period of time.
My colleagues are telling you that Queensland is now cut off with trucks waiting in Longreach, and we've got the flood warnings in Barclay as well. Obviously, it's changing very quickly, but is this something that could be reassessed today? Like, how quickly could the area be brought in, or big supplies in?
Mother Nature has proven to have many whips in her tail, and we deal with that all the time. As I've mentioned, we've currently got an eye on the Barclay. There are weather events that are coming through there. If we see any impact on the Barclay, then again, as the Chief's mentioned from the brief I provided today, that'll move us into an exceptional circumstance. If we're literally cut off from both South Australia and Queensland and our major transport road routes, then we've got to look at an alternative option, and that will certainly escalate that up into an emergency response where I think the Commonwealth would be willing and able to take a part.
Would the turnaround be like 24 hours to get a plane of supplies in? Like how long does that sort of...
Well, again, what we're going to be limited by is the capacity of any aircraft that we may ultimately be able to move freight to that level. But I hasten to add, be very reassured that there are significant supplies currently held in the Northern Territory. It's just some of the highly valued perishables that we're a bit light on at the moment. So we will certainly make every step, and I know that the emergency management arrangements that are in place across the country, if we put our hand up to say all the advice from the current commercial suppliers is they cannot maintain supply, then we'll take adequate steps, and that'll be a very quick and swift response.
Can I ask Dr. Marco a question, please? Given that 30% of the territory is reported as Indigenous, but we're seeing 90% hospitalised and the outbreaks in remote communities, is this disproportionately affecting Indigenous people?
Well, what we see in the territory, not now, but historically, is a disproportionate representation of Indigenous Territorians in our hospitals. The burden of disease among our Indigenous people is higher than in the general population, and the prevalence of chronic diseases like diabetes and renal disease, lung disease, and others, along with other social determinants of health, makes more Indigenous Territorians requiring hospital care in a normal circumstance. And any day, our hospitals care for about 70% of our patients being Indigenous. And what we're seeing with COVID is an extra addition to that. Most of that is driven by the fact that less and less resources are available in primary care to manage COVID patients in community, since this is a new disease, and we've been trying to centralize those resources in our major hospitals for these patients to access treatments like monoclonal antibodies, antivirals, and other hospital treatment that cannot be provided at this point in time in remote communities. What we would like to see, and what we are already seeing some signs of, is that we will build capacity more and more in our remote hospitals, in remote primary health care clinics, to provide those care closer to home. And we hope that then the number of Indigenous Territorians in hospital will be the same that we see at any given time.
As a result of that and all of the comorbidities, is it not fair to consider that there needs to be a different response for remote communities?
I think the response to remote communities needs to be proportionate and needs to be aligned with community expectations, community wishes, and community preferences. And that's what we're trying to do. And that's why the response to each community might be slightly different, because we need to engage with community leaders and community members and healthcare organizations in that particular community to see what's possible. If people want to stay closer to home to receive the care, well, that's what we should be aiming for. If people want to receive care away from community and want COVID cases out of community, we will try to match some of those expectations whenever it's feasible. We need to remember that we're dealing with a less severe illness than we were dealing with before. We have a much higher vaccination rate than we had initially, maybe not as good as we would like to see, and I'd like to take the opportunity to send a message to Territorians that have not been vaccinated now to please come and get vaccinated. We know it will protect you, but also it will protect your family. It will protect your elders. It will protect your vulnerable family members and your community from getting COVID and getting sick. So if you haven't been vaccinated, come forward and we will start your vaccination journey. It's one dose, and then the next month another dose, and then if you are already eligible for it, 3 months later you can have your booster. That improve your ability to fight COVID, not to have the disease and not to pass it on to your loved ones and vulnerable community members. And if you get it, it's less likely that you will be sick requiring hospitalization.
How close is the RDH to reaching capacity in terms of the number of hospitalisations of COVID cases before it starts to see or need the sort of surge capacity that the Chief Minister just talked about?
So again, I don't have specific numbers to provide today, but what we know is that we plan for a large number of cases to be requiring hospital care, and the numbers that we're seeing at the moment are something that we can manage with the existing resources, notwithstanding the enormous efforts that our clinicians and our hospital staff are putting forward to provide that care in hospital. We still have capacity to surge, which will mean diverting some resources from other areas and might mean reduction of some services. While we can avoid that, we will prefer to do so, and that's probably what Dr. Payne was referring to yesterday. We will prefer the numbers to stay as they are or not far from where they are, but we do have capacity to respond to Territorians at this point in time, and we also have capacity in our hospitals in Alice Springs, in Catherine, in Nhulunbuy, and Tennant Creek, in Palmerston, to provide extra care to some of these patients.
This one might be better for the Chief. So we talked a couple of weeks ago about the fact that Aboriginal community-controlled health organisations don't currently have a consistent supply of rapid antigen tests. We were waiting for the feds to come through with that. Do we have an update on the rollout of that?
As I understand it, we're still essentially rat sharing with the Archos. I don't believe they've got a consistent source of rats from the Commonwealth yet, no. So we're providing the Archos with their rats for their testing. As I understand it, we're giving them all the tests they need at this stage. I think they probably would prefer if they just had a large bulk of tests they could distribute as they needed at their discretion, which will come from the Commonwealth at some stage. I do believe that. But at this stage, we're sharing our rat supply with the Archos.
In Utopia, flooded in, as we heard, the clinic manager there says that the government promised an ADF plane last Saturday with food, rats and other medical supplies, and they're still waiting. Where is that help?
So the ADF had been trying to help us with an air asset. I don't believe the ADF air asset has come in. I can get the Commissioner to talk to that. We've been using other air assets. My understanding is the supplies came in just through a different method. I'll double check that, but my understanding is that we didn't leave the community without resources. It was more that it wasn't transported by a RAF plane, and we're working closely with that community. The Commonwealth provided, because it's a Archo community, the Commonwealth provided 8 additional nurses from outside Northern Territory into Utopia, which is very welcome. I thank the Commonwealth for that. We're obviously working closely with the Commonwealth and the local Archo about how we help, but I'll see if the Commissioner has more to add on that supply question.
My understanding was an ADF plane was arranged, but the commercial arrangements that had previously not been available became available, and so the ADF flight was cancelled. My understanding was, though, that transport arrangements had been made out there, so I'll take that offline to speak to my Emergency Operations Centre to understand what that issue is. I do know at the moment that there are Telstra communication issues that are being impacted through that in Bloodawatch region at the moment, unfortunately also linked to the weather event, so we'll make sure that they've got the supplies they need. We actually have, I know the Chief Health Officer's tried to be in contact with the clinic manager at Bloodawatch this morning and has been unable to establish contact, but I'll have our police officers from Alpara make some contact and ensure that that supply chain's been resolved.
And last couple, please.
Congress is taking an approach of putting, maybe you or maybe the Chief, putting signs on people's houses to inform people passing by that there are COVID positive people isolating inside, and in some cases doing that without permission. Do you think that's an appropriate measure?
I actually discussed it with Dr. Marco just before. I might actually have Dr. Marco add to this. The concern Health have raised with me is that while well-intentioned, we probably shouldn't be breaching people's confidentiality, and there is requirements on Health not to reveal people's personal information and symptoms, and so I might just pass to Dr. Marco just to add from a health point of view why there are some concerns around doing that.
Thank you, Chief. We know that our partners in Congress are doing an enormous effort to try to help controlling this outbreak, affecting many communities in Central Australia, many communities that are cared for by Congress from the primary healthcare perspective. My understanding is that the intention of Congress and some other health providers was to advise community about the risk of visiting particular households. Whenever that is done in partnership with and with the authorization of the owners and the residents of that house, that is a decision for each individual to make and to happily disclose that information. However, when that's done unilaterally, that's obviously potentially problematic with regards to confidentiality of those individuals that are isolating, and we obviously concerned about shame and other things that this might bring forward, stigma, etc. And we fear that that could drive to a decrease number of people coming forward for testing in fear of that shame or that sort of public exposure. I think, I would like to think, and I'm pretty sure that that's the case, that our partners in Congress did that in consultation with individuals and that was done respectfully and with the best intent.
Sorry, just one more question. But on that point, for the last 2 years, we've breached patient confidentiality by saying that whether someone is vaccinated or not vaccinated, and by announcing that in coalition with their death and often a comorbidity. How has that changed now?
I think that we haven't announced an individual name when they are vaccinated or unvaccinated. We have mentioned a case and trying to de-identify that as much as possible. And the intent of that information is to inform Territorians of the situation, like we do every day when we do our updates. We are very, very careful in ensuring that patient confidentiality, individuals' confidentiality is maintained at all times.
Chief, just can I ask a one question, please?
One more, Chief. Yep.
Chief, have you read the letter that the Mayor of Alice Springs has written regarding crime? And do you think the fact that he's desperately reaching out to the Prime Minister shows that you guys, that what is happening isn't working?
We take the situation in Alice Springs very seriously. There's been a number of completely unacceptable acts in Alice Springs. Residential break-ins, commercial break-ins, vehicle thefts. There is active work happening right now with the police, and there's been a number of arrests, which I think is excellent. So we take it very, very seriously, and I ask the Commissioner to add to that arrest quickly.
Have you read the letter though?
Yeah.
Unfortunately, January always sees a bit of a spike in activity, and that's certainly been the case, disappointingly, in Alice Springs in recent days. We know that there was 17 unlawful entries alone in the preceding 24 hours of Wednesday. However, overnight that reduced quite markedly. We've made a significant number of arrests yesterday. I've got Deputy Murphy currently down in Alice Springs yesterday, met with the Chamber of Commerce, they've met with a number of key stakeholders. They're staying on down there today to go and visit businesses and do all of those things. It's unfortunately a pressure point in Alice Springs at the moment. We had a significant planning in place, but unfortunately the COVID pressures has had to divert some of my resources away to provide support into various remote communities to ensure that people are being looked after in that regard. The efforts of the police on the ground in Alice Springs have been nothing short of incredible. Their passion, their intent to try and ensure that that community is being well supported can't be faulted. They are at the front end. They are working critically against a social welfare dependency challenge that has been in place for decades. Not in recent years, not in 30 years, for decades. And that's the unfortunate problem. And if people want to try and raise that issue at the national level, then I think it's highly appropriate that people start having the conversation about what the true causation is and why the highest welfare dependency is in place in those populations.
Thank you. Sorry, Tom Morgan, I had to get that off. Sorry.